professor, physician, epidemiology. I am Dr. Sri Banerjee. Hello, I am Dr. Sri Banerjee, epidemiologist, biostatistician, faculty member. And in this video, I'm going to be going over a little bit about clinical trials. Clinicaltrials.gov is actually a robust website. It's been recently modernized, and it's run by the NIH and the U.S. National Library of Medicine. So there are a lot of studies, and when I mean by a lot, I mean exactly 418,604 research studies. And this spans in all 50 states, 220 countries. So if you look at the listed clinical studies just for COVID-19, we're not even talking about any other trials, then you see that there's 8,113 trials that are there. And you can actually see multiple places where you can access COVID related clinical trials. Clinicaltrials.gov is only one out of 4 places where you can find studies related to this. The World Health Organization, whenever I get a chance, I give a plug for them. There's a World Health Organization Trial Registry Network that also has extremely valuable information regarding trials. The NIH, and then clinicaltrials.gov. This is another section. It's a beta section. So just going back. All right, so we're back to where we started here, clinicaltrials.gov, and everything is still the same, exactly the way it was before we left this website. And you can choose to find studies if there's any sort of advanced search that you want to do. You want to find a particular study that's good you want to learn about studies. You might even want to submit your own study to clinical trials, so you can do that. And so here's all the options up here. What we want to focus on today is trying to see a disease or condition. So what I'm going to do is I'm going to look at all studies. You can do recruiting and not yet recruiting studies, but I'm just going to do all studies. And I'm going to take a look at several conditions. I'm going to start off by sickle cell disease. So sickle cell disease, a condition that really affects your quality of life. And there's not an actual cure for this. But there's definitely treatment. So there's recruitment for this one study in assessing the prevalence of osteoporosis in sickle cell disease. So instantly, I mean, this to me, this is taking place in Lyon, France, but this to me is perfect to indicate that I can study sickle cell and osteoporosis as a potential dissertation topic if I were to write a thesis. The next one, IMR 687. This is, I guess, this is a drug that's being tested for sickle cell disease, but for some reason was terminated. There must have been adverse effects, or there might be other reasons. Here's an intervention type of study, which is interesting. It's a community health work and mobile health for sickle cell care, and this is for Connecticut Children's Medical Center in Hartford, Connecticut. Actually, this includes I think 5 children's center working together for mobile health and trying to make sure that some of the self-management, there's actually two self-management types of models that are being tested. And so self-management behaviors, patient activation. Now, I'm going to highlight this. Patient activation is something that is a buzzword that is being used more and more frequently. But biologic markers transferred to adult care. These are all interventions that are explored and can be actually implemented by peer community health workers. So community health work is coming in vogue. This is a good example of an intervention that can be carried out and transitioning from, enhanced usual care to improved health-related quality of life and acute care use for transitioning youth with sickle cell disease. So the problem is that sickle cell disease is still causes sevenfold increase in mortality rates during the transition period, during 16 to 25 years of age. This is why that acute care utilization during the vulnerable period is increased during this time. And I've seen patients in this age group, actually, in this specific age group, with sickle cell disease, and it's truly a vulnerable time period for emerging adults, and so this is an intervention that is important. So looking for potential other types of studies and interventions that are being recruited. And as you can see, the varieties of studies are many. It's not just limited to any sort of drugs or anything. It's even biofluid chip technology. So chipping people with sickle cell disease is potentially something that is being tested. And this biofluid chip technology can investigate surface characteristics that are typically measured with conventional techniques, but this is in a optical recognition, so it's much more efficient in capturing antibody levels. So some of the sickled RBCs, red blood cells, white blood cell, cellular adhesive inflammatory properties. These can be actually identified. So this is all theoretical, but theoretically identified through this, through the use of this chipping. So we can go back now and take a look at some of the other columns. So I want you to take a look. You can save some of these ones that seem really interesting. You can go ahead and click a study title like this one. I would definitely save. Conditions, interventions. The type of intervention was a questionnaire, and the location was France. So then you have the option of going by topics. So you can actually combine certain topics. In fact, 27 had acute chest syndrome, so you definitely do want to look into acute chest syndrome and take a look at what that may entail with corticosteroid usage and how that then complicates things. So already you can, if you're building a concept map, this is creating sort of additional topics. Acute kidney injury. Acute kidney injury is another potential related concept. where are these clinical trials being conducted? Fortunately, there's some that are being conducted in Africa. There should be more due to the higher preponderance in people of African descent. Of course, there's the theory that people with sickle cell trait are afforded protection against malaria. So there might have been an actual natural selection towards people that had this trait, which is why there might have been an increase in the disease condition. So this is a map, and then finally we can kind of go into search details. And this search detail goes into some of it looks at the number of studies that are corresponding to each of these conditions. So hemoglobin S disease, and then sickle cell syndrome, and there's even bile salt stimulated lipase. So the interesting related concepts that can even arise in this final sort of place to look. This can also give you ideas for potential outline topics. Thanks for listening.